Hi again, Matt, Glaucoma Pirates. So, catch up again, post-surgery. So, yesterday, which was the 15th of November, I went in for the emergency revision on my Baerdveldt implant surgery, as explained in the previous video. Sorry for the delay in putting some of these videos on, but the obviously have to be edited with the visuals in the background and then get onto YouTube and stuff. Sometimes it takes a couple of days, especially because I've been in surgery and stuff. So you'll probably notice there's a delay, but which is why I always state the date that these videos are done. But today's the 16th, so it's the day after surgery. I've just got back from my post-surgery check, and they've taken the bandage off and everything. Still got the arrow on, as you can see. Haven't been able to clean it really yet. Got to leave it a couple of days before I can give it a good clean. So yeah, so I'll start from the beginning with the surgery and talk you through that, and then things that happen during it, so that you know what to expect if you have to have a second Baerdveldt revision or something. I don't know, but just an insight to what happened. So went in as usual, as the same as all the other surgeries, 7:30 in the morning, got to bed straight away, which was good. Was told I was first on the list. This was probably the quickest surgery that I've had, to be honest with you, in that I was first on the list. I was prepared straight away. It almost seems like one after another that, you know, the nurse came in, did all their questions and did all their checking the blood pressure and everything, and then the doctor came to see me and talked through everything, and then the anaesthetist came to see me, talk through everything, and before you know it, they were taking me down. So I think I went down at about 9 o'clock, which was the earliest I've ever been down for surgery. Now the next bit was different, so I will elaborate slightly on it. So this is the anaesthetic. So if you remember from the last revision that I had, it was a general anaesthetic, and they also did a block, but they did the block after the general anaesthetic. So I had the general anaesthetic, I was out of it, then they did the block, and then I woke up and I had a really good recovery, probably the best recovery from anaesthetic, in that there was no dizziness at all or anything afterwards. I was like, you know, straight up, so that was really good. This time, different anaesthetist. I got the impression when he came to see me that he was trying to push me towards just having a local anaesthetic, even though the doctor had said, you know, I think a general is a good idea because I don't know how long this is going to take. I don't know how much. She didn't know exactly what she was doing until she went in, sort of thing. So that unnerved me a little bit. And then when I got down to have the anaesthetic, and I'm on the anaesthetics couch, bed or whatever, he then said that, okay, he's going to do the general, but he's going to put the block in before the general, which I thought, well, why do that? Why not do it the same as before, which is after the general? But again, I was in their hands, so it was like, yeah, well, you know, whatever you think, that's fine. Anyway, then obviously have to put in the cannula and everything and getting me ready for the general. Did the block, and I've got to say, I'm sure this is not everybody has this experience with the block. Not everybody has my eye. Not everybody has the. I've spoken to the surgeon today. You know, my eye is very delicate. It's complex. It's had lots of surgeries, so it's not a normal eye. But the local anaesthetic was, in my words, absolutely horrendous. It was. Yeah, something I would never ever want to experience again. I think I said in my cyclodiode when I had that done, if you look back at the other videos, that was under a local anaesthetic, and that was pretty bad. It didn't seem like the anaesthetic worked particularly well, other than making me go blind in my eye. It was still very painful when I was applying the laser and everything. But I'd sort of put that behind me. But I have always been a bit sceptical about local anaesthetic since then for eye surgery. I don't know if it's just because it's eye, so whether it's psychological, and it's like horror movie stuff, isn't it? Needles in the eyes and stuff. But anyway, so he started administering the block whilst I was still, you know, no sedation, nothing, just fully conscious, just lying there. And that goes basically underneath the eye, into the nerves at the back of the eye. And from the second he started, from the second he put the needle in, it was just absolutely agony. The nurse said, hold my hand, and I was like gripping it. I must have virtually broke a hand, the pain that it caused me. I couldn't, I was like holding my breath because I couldn't breathe. I could feel everything in my body was tense. It was like, oh, that's like, it was just, obviously you can't jump up and get out or do anything like that because the guy's got a needle under your eye. But it was, to me, really painful. And it was like he put it in, and I was thinking, don't worry, it's only going to be like a second, so it's not going to be too bad. It felt like he was jabbing around and stuff for, 4 or 5 minutes. It was probably only a couple of minutes in real life, but it felt like it was never ending. And they kept saying, you're doing really well, we've nearly done it now, and then it'll be another minute and still hadn't done it, and it was still going like, yeah, you're doing really well, and just trying to talk me down. But it was just horrific. The other thing that he was doing a lot of, which concerned me, is he seemed to be pushing my eye in and out of the way to be able to get to obviously where he's getting, and that was just really painful, because you can imagine I had surgery 2 weeks ago. The eye is painful anyway. Yeah, and it was just horrible. So, I'm really cautious with saying things like this, because I don't want everyone worrying that that's going to be their experience of local anaesthetic. I believe, and people that I've spoken to that have had them, so it's not a problem. But so I'm guessing that it's just because of previous surgeries and damage that's there, and whether they find it trickier to find the nerves to put the local anaesthetic into. I just don't know. But if there's anything I can do to avoid that in the future, I will. Obviously, if I've got no choice, I'll have to go through it again. But it really shook me up, and even after he'd done it, there was probably then a 2 or 3 minute delay before giving me the general anaesthetic, before putting me to sleep. And that whole 2 or 3 minutes, the pain was just as if he was still doing it. Really, it was until I was asleep, I was just in agony with it. But anyway, that's the bad stuff. I'm sorry, but honesty is the best policy. But that was the worst part of the day, really. The good news is, the general anaesthetic was fine. Woke up in recovery pretty much as soon as I woke up. They took me back to the ward, bought me some food. I'd go up to the toilet and everything else that they expected you to do. And I was really, this was probably, like I say, I went down about 9. I was back up in the room it must have been about 11:30, because it was just, it seemed like I'd been in the room 10 minutes and they brought the dinner around, so that must have been about 12. And I was told that, I could pretty much go, just waiting for meds to be brought up and stuff. But by 3 o'clock, they still hadn't brought the meds, and then they said that the meds probably wouldn't be arriving till sort of the evening. So I asked if, I've got to come back in the morning anyway, at 10 o'clock to see the doctor. I'm not supposed to be taking any of the meds until after I've seen the doctor and they've taken the patch off and everything. So they said that I could go back in the morning, which was this morning, to pick up the meds. So I was actually discharged at 3:30 yesterday, which was brilliant. So 7:30 till 3:30, all done, all dusted. That's the shortest surgery I've had as far as time in the actual hospital is concerned. So that was really good. The only other difference that I noticed really was, normally when you get home after surgery, you're sort of full of, anaesthetic, and you feel a bit high and a bit happy. And even though you had surgery, you feel better that day normally than you do like a couple of days later. The next day it kicks in a bit and you're in more pain, and then the day after that you're in a bit more pain, and then there's like a cycle and it starts to improve. But this time I felt awful, whether it was the experience with the local anaesthetic and stuff. But once I got home, I just felt awful all night, and just, I've seen a lot of pain still. So I was doing paracetamol every 4 hours and stuff, and all the rest of it. But it wasn't the best day after I got home. Having said that, woke up this morning, pain had pretty much gone. Obviously I've just got the normal pain that you would normally have. Like it feels like very dry and sore, and as if you've had an operation, surprisingly. But other than that, more comfortable than it has been in the past. The day after surgery, went for my appointment this morning at 10 o'clock. To have my checkup. My checkup was fine. She has managed to, I'll stick some pictures up, but she has managed to, I'll do this as well. She has managed to cover up that white triangle that was there. So that's all good. She sorted out the suturing. She did say she had to nip some other parts of the eye to release some more sort of pressure, I suppose, so that she had more skin to play with, because it was quite tight and stuff in previous surgeries. But other than that, so far so good. I've got to go back next Tuesday for another follow-up. She's happy with it at the moment, but obviously has to keep a close eye on it. So we'll see how that goes next Tuesday. I'll keep you updated and posted. I'm sorry this was a bit of a long one. I've just noticed it's 11 minutes, but there was a bit of surgery talk to get through. So no, thank you very much. I'm okay. I'm still smiling. I'm feeling happy now I've been back and seen the surgeon. I'm hoping my next surgery, which I think, providing everything goes to plan, will be my cataract in a couple of months, and then the removal of the suture on the implant after that. So I'm hoping that they can give me general anaesthetics for those, because I don't think I could bear that again with a local. Anyway, thank you very much for watching. Please don't forget to subscribe, and I'll see you soon. Cheers guys, thanks, bye.